activities,
Right.
then it would be D.
Yeah. So when assess the readiness, okay, that's the key right there, to assess the readiness to learn. So the readiness is assessed by what information do you need to know right now. And that's what's really, it has planning, so it says before planning. So then with the planning, that would be part of the planning. So if you've seen this before, the Kaplan decision tree, that would be an assessment versus implementation question. And this is an assessment question first, and then the next thing you would do D. So hopefully I'm not wrong here. So motivation.
I guess that's true. She would always say, ask them first, what do they already know?
Right. What do they know? You know, and what do they want? What do they think they need to know right now?
They're motivated.
Right. So the patient with poor circulation of the feet requires teaching. So all these are about teaching. We only have a short period of time, so I'm going to kind of go through and see what other ones we have, because I have a lot of slides on teaching. So following assessment of a patient with pneumonia, the nurse identifies nursing diagnosis of ineffective airway clearance. So what information best support this diagnosis? So you guys can read it. You guys tell me what you think.
A.
Okay, ineffective airway clearance. Okay.
Ineffective.
So all of these talk about deoxygenation, really. Well, not all of them. So this is the only one that's a mechanical. There's actually a mechanical. There's something in the airway that's not allowing it to clear. So the others actually talk about what would happen if we don't fix that. Okay? Oh, you know what? I was wrong. So the signs, so I was wrong about that. It identifies the diagnosis of ineffective clearway. I would also say large amounts of green sputum. I would count both of those things. So
Doesn't that mean they're getting it up though?
Oh, non-effective dry cough. I see what you guys are saying.
That's
right
what I
now.
got confused
That's
with
true.
too. Like if you're coughing it out a lot, then
Yeah.
it's
Yeah.
ineffective
that's
because
effective.
we're not practicing.
It's been a while
anything.
since
It would
I've
be
looked at these.
effective.
So you're right, because they're actually, the diagnosis is supported by this particular thing where they can't actually cough it up. You're all right. All right. During the assessment of the chest in a patient with pneumococcal pneumonia, the nurse would expect to find what sort of things. So we have vesicular breath sounds, increased tactile fremitus, dry non-productive cough, and hyperresonance to percussion. So bronchi and thick sputum, what action will the nurse do to promote the airway clearance? Which ones can we get rid of?
A, B, you can go with B, A and B.
C and, so C and, okay.
Wouldn't it be? Doesn't look like any. Well, why wouldn't it be A if it's
Right,
promoting airway
I
clearance?
wouldn't discount A.
Because you're promoting airway
Promote
clearance by helping
pursed
them
lip
cough
breathing,
it
that's
out.
to help them, but I don't think that
Yeah, that's more
actually,
like-
pursed lip breathing doesn't do anything to clear the lungs. And oxygen doesn't really clear the lungs.
Does splinting the chest?
Oh,
Why do they
look
need
at
to
this.
splint?
Would we restrict fluids?
No.
So what does it have to be? Gosh, I hope it is.
Why would you split the chest?
How does that help you
Because
get
it
it
helps
down?
them cough.
Do you remember that she was doing something like this?
Right,
That's
so.
not
splitting,
that's
yeah.
cuffing, like splitting the chest is holding something when you cough. How
Right,
does that
so
help?
it's kind of, you use the pillow and do it in between the chest and the abdomen to basically allow them to have more strength to cough something up. So you're trying to actually apply pressure to get them to be coughing that up, okay? So that splinting, that would help with that piece, applying the pressure. Okay, hospitalized for pneumonia, I think let's skip that one. we get to some, let me just keep, I'm going past this because I know we only have about 20 minutes. Okay. Which information about a client who has had a recent history of TB indicates that the nurse can discontinue the airborne isolation precautions? So this is something we talked about when we went
Wouldn't
around.
it would be D, right?
D, okay. Okay, did you guys talk about treatments for tuberculosis? So when they're receiving the rifampin for treatment of tuberculosis, what's an expected finding that you'll see below?
A.
Okay, A, that will be orange colored urine. There we go. I'm skipping through because I want to be able to see some others. Okay, this is a good one. So the patient's been admitted with pneumococcal pneumonia and has a temp of 101.6 with frequent cough and complaining of severe pleuritic chest pain. Which of these ordered medications should you give first? So Robitussin, Tylenol, Zithromax, or codeine. So cough suppressant, an anti-febrile medicine, pain medicine, or anti-infective.
Pain.
I'm sorry?
Pain.
Okay. So people often think of pain, but what's even more important, they've just been admitted with an infection. What do you have to get started before you address pain?
Tylenol.
They have to have an antibiotic first. So we get the we get the culture and sensitivity, we get the order going for the antibiotic first, and then we address those other things. So a lot of times people will think about pain being the most important, but it's usually a physiologic need, like some sort of thing that has to do with body physiology that comes before pain management. Okay, so gastric bypass. So they're undergoing treatment for morbid obesity, and they're undergoing gastric bypass. So highest priority on demonstrating passive range of motion exercises to the legs, discussing the necessary postoperative modifications in lifestyle, teaching proper coughing and deep breathing techniques, or educating the patient about postoperative presence of the NG tube. So it sounds like all of them would be good, but
B. Yeah, B.
Yeah. B.
so preoperative teaching, let's see what they're saying. Okay, so they're looking to prevent infection.
Pneumonia, yeah.
So preventing infection. But again, you would include those other things as well. Let me see.
What was the answer?
Actually, it was coughing and deep breathing to prevent pneumonia, because the pre-op people are going to be, it's not like the community health nurse. A pre-op person is going to be talking about side effects of the operation, preventing problems with the operation. So this patient is post-op day. They've had a gastric bypass, and the assessments that should be reported to the surgeon immediately. So use of the PHCA pump several times an hour for pain, so they may be having the breakthrough pain, irritation in skin, breakdown in the skin folds, bilateral crackles audible in both lung bases, or emesis of bile-colored fluid with NG tube in place. D. Okay, so why would we pick D?
Nasogastric tube should be going to your stomach, so fluid should not be.
Right, so that may mean that there's some problems
Or not.
with, and a potential aspiration, also potential, maybe they've actually had some problems with their sutures. Okay. I'm just skipping through some of these. Okay. The nurse obtains this assessment data for a patient who's been taking Orlistat several months as part of the weight loss program. Which finding is the most important to report to the PCP? So patient has frequent liquid stools, patient is pale and has many bruises, patient experiences a plateau in weight loss, the patient complains of abdominal bloating after the meals. So some of these are expected findings and some of them aren't. So which ones can we get rid of because they're expected findings?
A, B, C.
Okay, A and C. And so then that kind of leaves B and D. What do you guys think? B. They're pale and they have many bruises. Okay. So they may not be receiving an adequate amount of the clotting factor through vitamin K. So the other things are more common side effects. Okay. Okay. So a patient's been losing weight, about 1 pound a week for several months, and then they're waiting in the clinic and they haven't lost any weight. What should the nurse ask? The nurse should review the diet and exercise guidelines, B, instruct the patient to weigh weekly and record the weights. C, ask the patient whether there have been any changes in diet and exercise pattern. D, discuss the possibility that the patient has reached a temporary weight loss plateau.
C.
C. So we're doing that assessment first to find out what's going on with that patient. Okay? So. Okay, so teaching about possible metabolic syndrome. You guys have metabolic syndrome. So what would be done for the testing for that? Blood glucose, cardiac enzymes, postural, blood pressures, resting electrocardiogram. A. Because basically metabolic syndrome is what happens before diabetes. So a person starts to get overweight, they have changes in their blood glucose, and then if they don't make the changes that they need, then they end up having type 2 diabetes. So they actually have a higher fasting blood glucose. Okay, so teaching with the gastric bypass should include avoiding drinking fluids with meals, choose high-fat foods for at least 30% of intake, choose foods that are high in fiber to promote valve function. Development of flabby skin can be prevented by daily exercise. So which one do we choose?
I thought it was A.
A, okay, we talked about that. Avoiding fluids with meals helps to prevent dumping syndrome. Okay. Let me see, we have a lot of things. Which one haven't we? Okay, patient with gonorrhea is treated with a single IM dose of Rocephin and is given a prescription of doxycycline, 100 milligrams BID for 7 days. The nurse explains to the patient that this combination of antibiotics is prescribed too. You guys take a look at it.
Ladies and gentlemen, the time now is 5:50 and the library
Every
will be closing
5
in 10
minutes
minutes.
she's gonna.
All the reserved materials and
That's
study
true.
are now due. This is the last call for checkout. If
Isn't it
you
D?
are still at a computer,
Yeah.
please log off now. Thank you.
Okay. So, any others? Okay. Yeah. So, it's the incidence of co-infection between different STIs. So basically, they're treating any coexisting infections. I don't know that it would actually prevent the development of resistant organisms.
It was the one with the 4 drug?
The what? The 4-drug one.
I don't know, but I remember her
No, that's
specifically saying
tuberculosis.
something
Yeah.
was to
Okay, we reviewed
prevent
that.
resistance.
That was with the 4-drug.
Yeah.
We reviewed that. I'm just trying to see if any that we didn't talk about. Okay. Patient treated for chlamydia detected during a routine pelvic exam. The nurse knows that the teaching regarding management of the condition has been effective when the patient said, give me the antibiotic shot so I can be cured. My boyfriend will need to take antibiotics at the same time I do. I will use condoms during sex until I finish all antibiotics. Since I do not plan on having any children, treatment is not important. So we can get rid of a couple. And which one is the best?
B.
I'm sorry.
B.
Okay, B, because that C would not be appropriate because it's only until they're finished taking all the antibiotics. We do know that all the partners would have to be treated with antibiotics.
Why? I'm sorry. Could you explain why C wouldn't work at all?
Because it's saying until I finish taking all the medications. So basically, I will use condoms during sex until I finish. They should continue to wear condoms during sex.
Afterwards.
So the boyfriend's not treated as if he had.
Right, exactly, exactly. I don't know if you guys talked about that or not. Okay, I don't know that we did too many wound stuff, so let's spend a little bit of time on this. We talked about obtaining wound cultures and, incisional redness. So the surgical patient, the first morning after the post-op day, noticed that slight redness and warmth. We're expecting that this is a normal finding for this, and so we're going to document that assessment. So, I don't know how you guys went into that. So wet to dry dressings, when providing care for a patient with a pressure ulcer with pink granulation tissue. So the nurse will plan to use wet to dry dressings for which patient? So, which wound? Surgical incision with pink approximated wounds. B, full thickness burn filled with dry black material. C, wound with purulent drainage and dry brown areas. D, incisional stab wound with yellow drainage.
You would do that. Yeah, you'd be C.
Or let's see, C. Okay. So those others have things that would need to be debrided even more probably. Now the first one doesn't need really anything. The second one, maybe just a dressing to protect it. That second one, that eschar has to be removed, before they do anything.
So was it CC?
Okay. I think we talked about this, making sure you've gotten the pain medications in for that patient before you do dressing changes. Okay, this one's important. So of these things, what wouldn't we do when we're treating patients? So look at some of those decisions. There's one in there that shows what you would not do in wound care.
Ladies and gentlemen, the time is 5:55. The library will be closing in 5 minutes. Please begin making your way towards the exit. Thank you.
So one of them has something that we would not use in typical wound care, but is used a lot of times by families.
Cotton tip. The peroxide.
Yeah.
The peroxide, that's not typically used, especially in a stage 2 wound, because it's cytotoxic and will actually prevent granulation. Now, like if a kid has a little boo-boo and it's approximated, you can use that. You wouldn't want to use it too frequently. You wouldn't want to be doing it every day, but right away you could do that. But you wouldn't want to do a pressure ulcer with house strength peroxide. Okay, So this patient has stage 3 pressure ulcers on the heels. We know that, that is caused by pressure, but what other things make that patient susceptible to wound problems? The corticosteroids, absolutely. What that one was showing was LPNs can do wound care, and a lot of them do. They're experts at wound care. Okay, so a patient uses a fentanyl patch for chronic cancer pain, but complains of a rapid onset of pain at a level 9, and requests something for pain that will work quickly. And the nurse will document this as somatic pain, referred pain, neuropathic pain, or breakthrough pain. Breakthrough. Okay, so when you're a post-operative patient, they may have you take Motrin, like if you go home, and that talks about those non-steroidal, those NSAIDs provide that pain effect, and they also they decrease the pain sensitizing chemicals such as the prostaglandins. And I think we will do one more. Let me see a good one. Sorry. Okay, we talked about this one. We would give the medication for that patient. Okay, a patient with a history of chronic cancer pain is admitted to the hospital. When reviewing a patient's home medications, which of these would be of most concern to the admitting nurse? So Elavil, OxyContin, Advil, or Demerol. Did she talk about these kind of pain medicines?
Yes. Would 80 milligrams be a lot? I don't know. That would be a lot, especially for an opiate. Right?
They have chronic pain, so they may have developed.
Does it see like the ceiling effect? That's too much.
Yeah. If she didn't go over it, it's actually Demerol because it can create neurotoxins and seizures. Okay, here's one about titration. So healthcare provider plans to titrate the PCA to provide pain relief for a patient with acute surgical pain who's never received opioids. Which of the following actions regarding opioid administration are appropriate? So assessing for signs a patient is becoming addicted. No one wants to say. Monitoring for therapeutic
Library's frozen
endeavors.
up, guys.
Okay. Okay. All right. You guys will do well, I'm sure.
What's the answer to that?
What's the answer?
Okay, D&D. Monitoring for pain relief and teaching the patient about how opioids. I'm going to need for you guys to help me get the tables back in place, place, as well as the chair.
Richard, thank you so much.
I hope this was helpful. Sorry for some of my tangles.
There's one's highlighter. Yeah, it's mine. Thank you.
Are you able? We don't have, I don't know if that would be helpful.
You might want to go to the lower one after. You know?
Yeah, let me just ask.
Yeah. here?
What's that?
Could you click over here?
This test. You can put it and I asked the answer, so would you guys actually, let's say those would make me not have to do semester, would you guys actually have to do not pass the semester those 20 issues? We would have to. There's nothing that we could do. It's a legal issue, because if you get it to other people and things do it to you, I think it would be wrong to do it to anybody, me and other people.
And there was a scale are allowed to take off. Sleeping in, whatever.
Well,
I missed it or something like that because I didn't do my work. Okay, that I can understand.
so technically in the handbook, it says that you can have one excuse a semester, right? So I had a doctor's note. I didn't call for it. I didn't know that because last semester I just didn't get here on time, whatever. They took 3 points. So I guess they're still pissed about that. But the email that was sent to me like 3 or 4 days after or whatever was, as per your handbook, you were supposed to email us and let us know why you didn't come in, right? And it was like a past tense thing. So that's all I thought was that it was an email. But technically I'm supposed to call for it too,
So you have an email that you did send?
I did send, but I was supposed to call prior, and I said, well, it was last minute, I had full intentions of coming in.
The only thing I could say about that is, see if in the handbook it says specifically and in the email specifically. And even if you have old emails, like who to call, when to call, where to call. I mean, obviously you went through the person who you emailed, but if it doesn't give you that information,
I don't think there's that information. I didn't see it, but
double check. Look in the handbook. If it literally makes you not pass this class, fight it.
Or
Put a formal complaint in. You can do that.
I just find that they're trying to teach us to be compassionate people, and they're up there, and they just are kind of,
No, I understand because my husband's done it before. He had to put in a complaint once.
Oh, really?
I'm pretty tempted to put complaints into. You know what? I'm not trying to be mean in any way, since reform. I studied my ass off in the last exam, and I feel like we didn't cover a lot of that shit.
Yeah.
But did you come to this session last exam?
I've never gone to one of these.
Okay, that's
ever.
right.
Yeah.
So, the last one, I heard lots of people that did horribly the first exam. I mean, like, really bad. They were, you get desperate whenever you try to figure out what I'm going to do. So they came to the thing, the last one, and they made like B's. So I'm just like, what? That makes no sense. Because I felt like a lot of the stuff we weren't even taught, like Ransom's question.
So listen, it just so happened that it was right before, and I didn't sleep the whole entire night when I was doing the retake. but his was the very last. Was in this parking lot at like 7 a.m. before I had to take that at 9, and I was listening to his lecture, and it was like the end of the lecture was where a lot of those questions came from.
Really?
That he said, and I just, because I was like, thank God I freaking did that, because I wouldn't have gotten them if I took that test that first time. But it was like, it was the stuff that he actually mentioned, like, and I didn't see what I got right and what I got wrong officially, because you don't get to when you take a fucking recheck. Yeah, they just.
No,
But
even if you do make like a, say you make like a 79, technically by their handbook they say, oh, well, you made over a 70, whatever, so we can't let you look at it, even if it's just looking at your wrong answer. My husband was pissed because he's like, look, this is what I want to do for my life. I want to know why I got it wrong. Even if it's just...
Even if you got a 90. Even if you got a 98.
Even if you got, okay, 90s,
But you want to know, what did you get wrong?
You're right,
Why?
but I understand that like, okay, if they want to check the test integrity, fine, okay, but like, if you're like 1 or 2 points off of what that validates you as checking your test, like, that's bullshit. I'm sorry, that's bullshit. Like, you should at least be able to look at your wrong answers, right? So, and he was kind of mad about it. And it says in the handbook, 78, you're highly encouraged to go look at it, but it's
So
basically
78 or less, right?
Yes.
So technically, my number when I reviewed this, I did wind up review, but it was a 78.5 at that point. But she wound up giving me points back or something. But she's like, and technically, I'm not even supposed to be sitting here with you. And I'm like, she's like, well, no, because it's really under 78.
Yeah.
But I think it's 78 and less.
Yeah, I think it's 78 and or less. At least that's what we looked at the handbook recently. But
of course, they should review that. And
yeah, if they really, I mean, for test integrity, I'm sorry, but you have a test bank. You have, professors here that actually can write questions. Like, if you guys just are trying not to write questions, it's stupid. Like, if you have a test bank that you're going to use every, so often, like, you're going to have to make up new questions because there's going to be people who retake these courses.
Of course.
Well, it just doesn't make sense to me, but I would say that if you can find it, like if you can find a discrepancy, obviously use a chain of command. Don't wait last minute. Do not wait last minute.
Yeah.
I know it is already kind of like the last of the semester, but don't wait last minute to the point because basically after this semester's over, a lot of them are going on break and you're not going to be able to get much done. So if you can find a discrepancy, go to, I think it's technically, you already went to your mentor, so that's done.
I didn't go to my mentor.
Oh, well, you went to Eisen, which
that
is
was
one of
just
the
to review the
professors.
test.
Yeah, so you already went there. You can email your mentor, you can meet with them. They don't give you what they want. Be like,
You mean if I fail, though? Is that what you mean?
Yes,
if
but
they're
if it's already like
potential, yeah. I have to do really well on this test.
Exactly. So if it's potential, I would
Start looking into it.
Yes, and I would at least put an email like today, tomorrow, because that one shows you're proactive. 2 shows that like you're not scrambling, and honestly it's going to feel like scrambling if you're trying to pass this course with so many points given but don't wait last minute. And then obviously if you just use a chain of command, so don't go like mentor freaking director of health science. Don't do that.
Right.
Go and try to use, and I'll be honest with you, they're all fucking bitches. They're all gonna be really mean and nasty towards you, especially Joanna McBride. Rebecca,
I had to give her my doctor's excuse. She's like, so what was wrong? I said I was sick. She's like, but what? Like, and it was.
Ask you to have.
Yeah. Oh no. It was so. And I was like, this is the thing. And Eisen was trying to explain it to me. She's like, well, listen, we're just trying to get you guys to have this work ethic, where, you wouldn't just no-show to a job, and I said, we're trying to instill that into you. I'm like, that has been instilled to me forever. I would never, ever no-show for a job. And I said, I honestly just did not see it as a job-like thing. I said, now I see that you guys see it like that, and now I know, but I really was just unaware that it was such a fucking big deal.
Yeah, they tried to get my husband for that shit last semester because he had a doctor's appointment. The VA, I don't know if you know healthcare at the VA, but it's awful. A 30-minute appointment will essentially turn into about a 4-hour one. So he had plenty of time.
Yeah.
But he missed his clinical, which you get a makeup.
You can miss one.
You can miss one. And it wasn't like it's invalid. So he went. He had no problem making it up. Like, there was not going to be an issue. He didn't fight that. But the fucking instructor came in, McBride came in during his clinical and, like, gave him shit about it. And he's just like, oh, man, like, you're there, and they overschedule us on clinical hours. We're only supposed to have, like, I can't remember the number, but it's something like 60 hours, and we're scheduled for, like, I don't know, 68, so like almost like 20 hours over than what we're actually
We have a little
needed for.
wiggle room anyway.
So you have a little
Should.
wiggle, yes, and I think that's why they tell you can miss 2 total, but that second one could fail you, kind of thing.
Right.
Because technically, you know, you're right there.
Right.
You're right there to miss it. But anyways, regardless, yeah, he was like giving shit about that.
But they're
and it's just like they're really mean, and they'll make you feel like shit. I'm gonna be honest with you, they will. But that's why you say, you know, well, I went through this. It says in your policy right here. And if you're not going to be clear about it, you should fix that, because that's
I
not right.
I said I don't even know who I would have called. And I was like,
If it
you
does,
could have just even texted. I'm like, how do I know
I'm gonna
that?
text you.
How do I? She's like, just so I could say, you know, that you did reach out, you know.
Yeah.
Well, so after I did shitty on this past test, and I was just like, crap, I'm like in trouble, and I wasn't even thinking that they were going to give me off 8 points.
Yeah.
That's the most, and why am I even bringing them letter in if you're going to take it off? Anyway, so I emailed all the professors for this next test, and I just said, hey, reaching out for help, you know, I'm going to fail if I do not do really well in this next test, and I think that I'm reading the study guides wrong because it is not streamlining my studying in any kind of way.
Yeah.
And I think I'm taking the tests wrong or reading them wrong, and I'm running out of time. I said, so I just really need help from all my professors, so I just said that just so they all knew that I wanted basically to see all of them. They're all different, you know.